Welcome to Natural Medicine's Evidence in Practice. I'm Jeff Langford, a pharmacist and managing editor at NatMed.
And I'm Andrea Stafford, a pharmacist and assistant editor with NatMed. If you work with natural medicines or you're just simply curious, you are in the right place.
On this show, we'll cut through the noise and trends to bring you practical, evidence based guidance.
And in today's episode specifically, we are going to focus on nutrition and lifestyle counseling for patients using GLP-1 receptor agonists for weight loss to help meet key goals of reducing body fat while preserving lean mass and avoiding key nutrient deficiencies.
And a quick note, CE credit is available for our podcast through our monthly NatMed newsletter. Check the show notes for how to claim it.
Now, you might be surprised that our first podcast isn't focused on a popular supplement or vitamin. That's certainly a key part of NatMed, and we will cover topics like turmeric in the future. But NatMed is also about the big picture, including lifestyle strategies that make a difference. And right now, many patients are using GLP-1 receptor agonists for weight loss, so equipping clinicians and patients with guidance on lifestyle considerations to support their journey is essential.
Okay, Andrea, well, let's dive in with a little background. GLPs definitely are in the headlines every day. So, this drug class includes semaglutide, Ozempic or Wegovy are brand names there, and tirzepatide, Manjaro or Zepbound. And these medications have a key role in managing a lot of conditions diabetes, kidney disease, and cardiovascular disease, to name a few. But where they've really exploded is for weight loss. And we can expect continued attention on this class of drugs. For example, in December, we saw the FDA approval of a new oral daily version of Wegovy. So attention has been there and is expected to stay there for quite a while.
That's right, Jeff. Well, we continue to see this rise in popularity. GLP-1s also have a range of uses, but it's because of their effectiveness compared to other weight loss options that they are getting a lot of extra attention. In some cases, people may lose around 40 pounds on this therapy, which is approaching the magnitude of weight loss seen with bariatric surgery.
And how they work, of course, is reducing appetite and food intake. Now, the risk and the downside that we need to have front and center is that without a plan, patients can lose muscle and miss key nutrients. Some data suggests that about 20% of the weight lost with the GLP 1 is actually muscle loss. So, one of the goals of our conversation today is simple. How can we help patients lose fat, protect that lean mass, and cover their micronutrient bases?
And to do that, Jeff, we want to make it easy using a three-part framework we call the three Ps. Protein, looking at protein intake and tailoring it to the patient's needs. Portion control or plate, meaning we keep protein and produce front and center. And then plenty of water and fiber to keep everything comfortable.
Well, I love that 3P approach, Andrea. Protein, plate or portion, and plenty of water and fiber. The points that you lined out there, Andrea, are really key for success while working to lose weight. And we can keep in mind this framework also applies to patients as they're seeking to maintain that weight loss further down their road, or for an overall health approach for patients who have diabetes or cardiovascular conditions.
So let's start with the first P, protein, because having a target is helpful. Ideally, increasing protein is important, but there's not necessarily a one size that fits all. And different professional organizations and guidelines do have slightly different recommendations. But a simple rule of thumb for people using weight loss medications, this aligns with the guidance from ASPEN, the American Society of Parenteral and Enteral Nutrition, is to aim for 1 to 1.2 grams per kilogram of body weight per day for adults who are sedentary, and 1.5 grams per kilogram of body weight per day for physically active adults to preserve muscle.
Well, Andrea, one thing that comes to my mind as we start talking about these targets is how do they compare to the new dietary guidelines that we've been hearing so much about?
Yes, perfect question. Not a lot of variation, but slightly. The new 2025 to 2030 dietary guidelines recommend 1.2 to 1.6 grams per kilogram of body weight per day and adjusting that as needed based on individual caloric requirements.
Okay, so these different guidelines are giving pretty similar numbers.
Yes.
But what's the background behind those targets?
Another great question because we don't just have these numbers out of thin air. There is some evidence behind it. In clinical research, intakes around 1 gram per kilogram of body weight per day have been associated with a greater risk of muscle loss, while higher intakes, often 1.3 grams per kilogram of body weight per day, are more consistently linked with better muscle preservation.
Okay, Andrea, that's really helpful. That gives us some idea of how much protein we need to get to preserve muscle. But let's break it down to an example. If we had a patient who weighs about 90 kilograms or roughly 200 pounds and is sedentary, based on those Aspen guidelines, we could target 90 to 108 grams of protein per day. Now, the thing that comes to my mind is this might be a little tricky to actually do. How do we get that much? How do we help patients get that much protein in their diet?
Exactly. I think that's a great question because we hear those numbers and then we think, what do we do with them? So, first, we want to spread protein across 3 meals. It's usually easier on the stomach, too, than trying to get it in all at once anyway. Second, we can have patients eat protein first before we start to feel full. And then third, when possible, we want to lean on whole food proteins. So think chicken, fish, eggs, and dairy.
And to help patients meet these specific intake recommendations, we do have a resource on our site, NatMed Protein Chart, that shows how many grams of protein are in typical portions of different foods. And that can really help make these recommendations very concrete and specific for patients to determine how much and what foods they can target to meet those protein intake goals. Now that we've got protein set, let's think about that second P in our framework, protecting space on the plate. So we're going to talk about portion size and the plate because those things go really hand in hand. And I think in my practice, one of the things that I've particularly liked is the MyPlate method because it's so visual. So we can just picture one of those compartmentalized plates that may be divided into four sections, and we can illustrate for patients how to fill that ideally, and that would be using one section or one fourth of the plate for protein, half of the plate, or two of those sections for vegetables and fruit, or all vegetables, and then the last section for grains. And if we can illustrate that, that gives patients a very concrete visual for how they can fill their plate ideally. And then the second thing that we can talk about is really how much is a serving size. When we talk about filling one of those compartments, we can put some examples to that as well. So if we're thinking about vegetables and using chopped vegetables as an example, a baseball is a good illustration of a serving size there. A fruit serving of a whole fruit, like a whole apple or orange, is about the size of a tennis ball. If we're thinking about carbs or grains, a serving size is roughly equivalent to the size of your fist was a good illustration. And we can think of a deck of cards being a good equivalent for a protein serving. So we can help patients see the plate and how it should be divided up and some nice clear examples of the amounts of food that comprise those different servings.
Yes, and as a visual learner, this helps me immensely when I'm thinking about my plate and the best way to kind of organize that. And as we're talking with patients through that my plate picture, what to eat and how much, I think there's one big thing we can't ignore, and that's that these medications can change how eating feels.
Mm.
A lot of people deal with these gastrointestinal side effects, things like nausea, diarrhea, or constipation. And you'll hear numbers in the ballpark of 20 to 40% of patients experiencing these. And it's usually most noticeable when they're just starting the medication or when that dose was just increased. So I think it's important that we give patients a few practical tips up front because if they're feeling crummy, it's a lot harder to hit protein goals or our nutrient goals or our fluid goals. And with that being said, stay tuned because this will be discussed in more detail towards the end of our show because this is a common concern for many patients.
Okay, well, thanks for teeing that up, Andrea. I do think that's a super common question. Let's move to our last P, and that's plenty of water and fiber. Both of these are important for comfort and health. And you just really described the frequency of constipation and other GI adverse effects for GLP 1s. In addition to the medications causing that themselves, as patients move to a higher protein diet, that can also contribute to constipation. So we want to really focus on hydration and fiber to help keep everything in the GI tract moving through normally and reduce side effects and problems for patients. So we can encourage them to get 2 to 3 liters of fluid per day, especially during that GLP 1 dose initiation or titration phase. And just to couple that with good dietary advice, would like them to favor water, still sparkling or flavored water, as a way to meet that fluid intake goal. And one thing that I think works very nicely to help people along this way is just using a reusable water bottle, filling that, measuring off their target for the day, and then kind of checking in to see how they're moving toward that goal.
Yes, and if you could see us, we have our refillable, reusable water bottles next to us even. And so building off what you just said about hydration, Jeff, fiber really works best when it's paired with plenty of fluids. But looking and thinking about targets, the dietary guidelines for Americans state women need 25 to 28 grams per day, and men need about 31 to 34 grams per day. And for people actively losing weight, the Aspen Guide for Clinicians suggests aiming for at least 21 grams per day for females and 30 grams per day for males. So, again, very close in numbers. Either way, starting with a food first approach is ideal: fruits, vegetables, beans, and whole grains. And if someone just can't get enough fiber through their diet alone, because that can be difficult, psyllium, a soluble fiber, can be helpful as an add on and is found in several over the counter products in various forms, such as powder and capsules.
Mhm. Okay, so we've talked about the 3P framework, emphasizing protein, portions, and plate, and plenty of fiber and water. But that's really not the whole story yet, is it?
No, it is not. And these three P's are a great and simple foundation, but you're right, it's not the whole story. When someone's food intake drops a lot, like it often does on GLP 1s, nutrient deficiencies are a concern. It's just more challenging to get enough vitamins and minerals when you're eating less overall. The ones I'm most mindful of are fat soluble vitamins like A, D, and E, and then a few of the B vitamins, particularly thiamine, folate, and B12. On the mineral side, iron, calcium, and magnesium are important too. Our main message again is to try and cover that with a whole food strategy first. You may have heard the phrase eat the rainbow, and it kind of sounds like a cliche, but it really works. More colors mean a wider mix of nutrients. For example, leafy greens are a great source for vitamins A, C, E, and K. Red and orange produce really help with vitamins A and C as well. And then don't forget legumes, beans, lentils, chickpeas. They're not just for protein and fiber, they also bring in iron, magnesium, and B vitamins.
Okay, so a real takeaway is to keep it whole food first. Refined and processed options are going to strip out fiber and key nutrients. So we do want to steer patients toward those minimally processed choices.
Yes. So we've talked a lot about what to eat to support success, but how we move can be just as important, especially for long term weight maintenance and lowering health risks. The big picture guidance here comes from the US Office of Disease Prevention and Health Promotion. And that's basically move more.
Mhm.
But they do provide some additional guidance regarding substantial health benefits. They recommend either at least 150 minutes a week of moderate intensity activity, such as brisk walking, recreational swimming, or 75 minutes a week of vigorous activity like running, jogging, or lap swimming. And then there's that piece we can't forget, which is strength training. We want to aim for muscle strengthening workouts at least twice a week. That's also where our nutrition and our movement connect, because strength training paired with enough protein is what helps preserve muscle mass when we see that number on the scale decreasing.
That's right, Andrea. And really, one of the things I want to emphasize here, because I think these numbers are things that people loosely have heard and are pretty familiar with. But I think one of the opportunities we have as clinicians is taking those goals and then helping our patients individualize for success. And that might be around individualizing to the patient's preferences. So, learning what are the movements that they like or conversely hate, and which ones can we help them identify as part of reaching that activity goal. So it may be very traditional things like walking or biking. It might be some less traditional things like gardening or pickleball or tennis, but learning their preferences is going to be key to helping them kind of consistently hit those activity numbers. And then, secondly, what I think is super important in this conversation is for some patients, they may not be very active now, and that may be due to mobility limitations. And so we need to figure out what their abilities are and how can we further tailor our recommendations. So if we're talking about strength training, for some people that may be just as clear cut as going to the gym to lift weights. Other people may prefer something that's home based, using just simple body weight workout or using exercise bands for resistance. And in some cases, may want to really recommend that our patients pull in a trainer or physical therapist to get started if they have very low mobility at baseline. So I think simple messages we can reinforce for our patients is start low and go slow. That consistency is going to beat intensity, and really any activity is better than none.
And I think that's a great point, Jeff, is to meet patients where they are and
Mhm.
also remind them that any movement is better than no movement, like you had stated. And I know I feel better, as we probably all do when we get up and just have some type of purposeful movement throughout the day.
Absolutely. Let's take a detour for a quick spotlight. If you want to take this guidance further, NatMed Pro gives you point of care tools that can help you make counseling more efficient and more effective.
Yes, think practical charts and visuals. So we have charts with foods high in protein, calcium, vitamin D, fiber, so that you and patients can easily map the way to hit their intake targets. You can also get detailed reports or monographs for specific substances like vitamin D or B12. And don't forget our GLP-1 toolkit to help with quick, confident decisions at the point of care.
Plus, CE options and our monthly newsletter for ongoing updates and clinical pearls.
And the best part, listeners can save 10% with code NatMed1026 at checkout. Links are in the show notes. But now back to where we put this content into a real world perspective.
And at this point, we're usually going to pull a patient case, a story, or listener questions and answers into our conversation.
And this time, the questions bubbled up close to home as coworkers have shared their personal stories and challenges about GLP-1s for weight loss. One important question always came up, and that was, is it okay to use protein shakes or bars to meet protein goals?
Yeah, so important. And this really reflects what we talked about earlier. We do want the first target to be aiming for whole foods. Bars and shakes often come with a lot of added sugars and fats. So we want to start with whole foods, and then we can think about those things if needed to kind of fill in our protein intake to hit the target, but kind of saving those as a second or third line option after we've done optimization of the whole foods. And a related question that I heard, Andrea, as we were talking about this, as we're thinking about how to meet nutritional goals, was should I take a supplement or vitamin, or what supplements and vitamins should I take while using a GLP-1? And I think the best way to consider this is really individually for the patient in front of us, based on what we know about their specific intake and needs. So, up front, during that initial transition period, as people's diet becomes acclimated to GLP-1, I think it's reasonable for many patients to consider a daily multivitamin up front that may help us avoid some deficiencies due to low dietary intake. Now, they may not need a multivitamin long term, but it may be reasonable for a couple of months just to give us a little bridge to see where we land in terms of their overall diet as they adjust to therapy. And then, thinking specifically again about our patient, in some cases, such as older or postmenopausal adults, there are certain supplements that might be beneficial in those cases, like vitamin D and calcium. And I would say we'd approach that the same way. It may be reasonable up front to say, let's add this supplement. Let's get back together in 3 months as you've adjusted to therapy. And if you're not meeting nutritional goals dietarily, we can consider whether to keep those supplements on board longer. Now, I know a few minutes ago you set up a really nice teaser for us that we were going to talk about some dietary ways to help manage nausea. So, what do you have for us there, Andrea?
Yes, as we had just discussed a little bit earlier about some of these side effects, nausea is a really common one with GLP-1s. And there are some practical changes that can make a difference for patients. One, for example, is to eat smaller, more frequent meals slowly. Other changes they could implement include stopping when you feel satisfied, but not stuffed. Also, avoiding fatty or high fiber foods during the first few days of treatment, as well as avoiding very sweet or spicy foods, dressing or sauces that contain high amounts of fats and additives, and avoiding strong smells. Think sardines, anchovies, and sauerkraut. Now, you won't find me eating those, but for the individuals who do enjoy that, that strong smell can lead to that feeling of nausea. I also tell patients to try and find patterns. Again, are there certain foods or smells that trigger those symptoms? Is there a time of day that is worse? And kind of planning their meals around those. Lastly, we don't want you to skip meals to try and kind of avoid it. Nausea often shows up in the morning or after longer stretches without eating. So instead, we usually recommend small, frequent meals or snacks about every 3 to 4 hours while you're awake.
Well, those are practical solutions and recommendations, Andrea. And I think what came to us as we had this conversation with our team and we're learning the questions they had as real GLP-1 users was that there is an opportunity for us to really support both diet and lifestyle recommendations for patients who are getting started with the GLP-1. And those kinds of questions and ideas are exactly what we want to hear from you. So please send us a text or email at contactus@trchealthcare.com. Link is in the show notes with questions, topic ideas, or any other feedback.
Perfect. So, really, just to kind of wrap this up, I think the takeaway for patients could be very simple, such as have a plan. Thinking back to those 3 Ps that we discussed earlier: protein, meaning we prioritize protein, portion or plate, eating regularly, focus on whole foods, referencing that eat the rainbow, and plenty of water and fiber.
Absolutely. These medications get a lot of publicity, as we said up front, and I do think they're a powerful tool, but they're not a panacea. So we do want to encourage that proactive and long-term lifestyle modification, both in what we eat and how we move hand in hand with these meds to set our patients up for long-term success.
And on that note, let's kind of wrap this up and how we can claim CE.
Absolutely. So you can follow instructions linked in the show notes. We've also included the GLP-1 toolkit and the newsletter article we discussed so you can bring these tips straight to practice.
And also, just want to bring note to our January newsletter, where we also cover some other interesting and timely topics, including supplements for dry January, long COVID recovery, and we do a spotlight on chickpeas that we just mentioned a little bit earlier. And in our most recently published February newsletter, we dive into vitamin D supplements, including what to consider for daily use. It's quick, it's practical read that pairs well with today's conversation specifically if someone may need vitamin D support.
And I also want to mention one of our sister podcasts, Rumor versus Truth. It just covered more on GLP-1s in their January episode. So go check that out. And now for our show, follow and subscribe in your podcast app so episode 2 lands automatically.
And we want to thank you for listening to Natural Medicines Evidence in Practice, Evidence, Not Hype.
See you next month.